When I see you in clinic, sometimes you already have a diagnosis of cancer and sometimes you just feel a lump and you need further testing. And so if you haven't been diagnosed with cancer yet, but you have a lump, then we will proceed to get imaging with you right there in the breast center. And usually we're able to do it on the same day. The sequence of treatment options vary depending on the very specific type of cancer that you have. And so we take the receptor status, the size of the tumor, your age, all of those things in account. So for some women, surgery up front is the most appropriate treatment. And other women, systemic therapy like chemotherapy or endocrine therapy or targeted therapy is the appropriate step for them. For breast cancer patients, there's a variety of surgical options. One option would be like a lumpectomy, which is a breast conservation procedure whereby we remove the tumor and a rim of normal tissue and the woman is able to preserve the rest of her breast. Another option would be a mastectomy, which we remove the breast based on the anatomical borders, and that allows a woman to also undergo reconstruction. So one of the procedures that I commonly perform is something called a skin-sparing mastectomy, and that's where I preserve a portion of the skin, the breast envelope, and it allows the breast to have its natural contour and facilitate reconstruction. So most of the patients that I see that need a skin-sparing mastectomy are patients with a cancer diagnosis, but there are also patients that have a genetic mutation like the BRCA1 and 2 mutation that put these patients at higher lifetime risk of breast cancer. In some of these women, a risk-reducing procedure is necessary, and a skin-sparing mastectomy is an option for these patients. With a lumpectomy, it's usually a day surgery, meaning the patient comes in the day of surgery and early in the morning, and then they undergo surgery, and then they usually spend a small period of time in the anesthesia post-operative care area, and then they're discharged home that same day. For patients undergoing a skin-sparing mastectomy, you arrive the morning of surgery, usually very early. You undergo surgery with me where I remove the breast, and then the plastic surgery team comes in and does the reconstruction part. These patients usually spend a night in the hospital, and this is really to optimize pain control for the patients because we want to find a pain regimen that works for them before we send them home. These patients go home with drains. The drains are very easy to manage and optimize the recovery and the outcomes from surgery.